Hello, everyone. Welcome to today's health discussion. My name is Deborah, and I'm here with Dr. Adesoya Adewale, a well-known gynecologist. Hello, doctor. How are you doing today, sir?
Hello, Deborah. I'm very fine. I'm very pleased to have you around. Thank you for coming.
I've seen some of your videos online, and I must really say they are very amazing and so educative.
Thank you very much.
But there's this particular topic that has been bothering my mind, and I feel I should come and ask you about it.
And which topic is that?
Cervical cancer.
Okay.
So
Beautiful.
please, I don't know, can you enlighten us? Can you tell me what cervical cancer is?
Oh, okay. Thank you for coming again. It's good to have you around. And the interest in cervical cancer. Cervical cancer is a very important topic, particularly in our environment, because it's still a major health challenge in sub-Saharan Africa, especially including Nigeria. So cervical cancer, like the name connotes, cancer of the cervix. What is the cervix? The cervix is the entrance, or let's say opening, of the uterus. Now, the female reproductive system includes the ovaries on both sides, connecting to the womb with the fallopian tube. Then the womb sitting above on top of the vagina has a connection. That's the cervix, and that cervix is entering the vagina too. So by location, the cervix get a lot of insults. Even when you are having sexual intercourse, that's where you eat most.
Really?
And then when there's vaginal discharge, it gets its own insults too. When there is this, when there is that, because of the connection with the outside. So that's notwithstanding, the other parts of the reproductive system, they can also have, but they can also be cancerous. But cervix is easily accessible, easily preventable. You can easily check it. So we shouldn't be having cervical cancer.
Okay, thank you for that. So can you tell me what are the causes of cervical cancer? Like what causes it?
Talking about the causes of cervical cancer, I will look at it from the main cause, or you say primary cause, or secondary cause. When you say secondary, maybe the risk factors, something that predispose you to having cervical cancer. So it's been established worldwide that cervical cancer is caused by persistent presence of human papillomavirus in that place, in the cervix.
Human what?
Human papillomavirus is a virus and is a form of sexually transmitted infection. We mentioned that in one of our videos too. So there are various factors that predispose someone to having that human papillomavirus present there or being persistent there that will not lead to cervical cancer. So risk factors, which we can look at as secondary factors, maybe your age. Between 30 and 50, one is at risk. If you have multiple sexual partners, you are at risk. Because even if your system is clearing the HPV, because you are constantly bringing them in, especially the high risk type, you're prone to having cervical cancer. So also when you smoke, smoking particularly has been implicated in causing or predisposing a woman to having cervical cancer. Then when your immunity is also low. So when we talk about the lifestyle, I keep bringing that anytime I'm doing video, because it's common among our people to trivialize those things. Drink a lot of water, sleep regularly, exercise regularly, eat healthy, balanced diet, and all these things. People trivialize them, but they have ways of building your immunity instead of chasing supplements up and down, wasting lots of money. Do the basic thing and build your. So when your immunity drops, you are also at risk of having cervical cancer, particularly because the nature is designed in such a way that this human papillomavirus, they are not supposed to be So they almost every lady, once you're sexually active, you have been at one point exposed to human papillomavirus. But the body, there are over 100 types of human papilloma. The body has a way of clearing this organism, over 75% of that. So they clear them. So, but there are factors that make them stay persistent and they will not go. And that when that happens is when the cervix starts changing, and then you are prone to having cervical cancer. Are you getting it?
Yeah.
So these are various things that can make you happen.
Thanks for the information, doctor.
You're welcome.
So please, what are the symptoms one is likely to see to know that the person has cervical cancer? What are the symptoms of cervical cancer?
Symptoms of cervical cancer. This is another angle where cervical cancer is seen as being a very dangerous and dicey condition. This is because in early stage of cervical cancer, it usually gives you no symptoms. You will not see anything
at all.
By the time you start seeing symptoms of cervical cancer, you have already moved to what we call, in our local parlance, sorry stage. It's already a sorry stage, advanced stage. Are you getting it? So normally you don't want to wait till you have symptoms, but by the time it becomes symptomatic, those are the ones that have what we call vaginal discharge, not resolving. Vaginal discharge that you use all sorts of treatment, you've done this, you've done. It's not stopping. Then what we call contact bleeding. You're having sexual intercourse, you're seeing blood. You are doing just minor gynae examination, blood everywhere, or you're having prolonged menstruation too at times. Then these are few of some of them. You can also have pain at times when you get into advanced stage, chronic pelvic pain. So, but we don't want to get to this point. Are you getting it? So I would say it's asymptomatic most of the time. So you need to get to it before it starts showing you.
Okay, so doctor, how is it detected? How do you diagnose a patient that this person has cervical cancer?
I used to talk about diagnosis in various forms. So most diagnoses are done in the hospital. It's a clinical setting. So talking about how to diagnose is just bringing to your maybe when you are discussing with your doctor to know what to expect. It's not for you to diagnose cervical cancer, because you should not even be diagnosing cervical cancer because of symptoms you are having. So this is what we talk about. Maybe we should talk about how to prevent it.
Okay.
And I look at prevention in two different ways, because prevention may lead us to maybe the diagnosis. Because I love to take prevention first. Knowledge, being aware of what cervical cancer is all about. Then you look at what are the maybe primary ways of preventing. This is when you are well informed with knowledge. And again, at the early stage, when you are well informed, you know that you need to vaccinate your girl child at maybe age 9, 10, 11. Vaccination, I would like to emphasize here, vaccination does not preclude regular screening of the cervix, pap smear. Are you getting it? So you are informed, you have vaccinated yourself, you have done the necessary thing to avoid yourself being predisposed to having cervical cancer. No multiple sexual partners. You do a lot of exercise, you eat balance, you build your immunity. You are above 30 and you are regularly screening yourself for pap smear, which is done once in 3 years when you do pap smear alone. If you combine with what you call HPV testing, I told you that the main culprit when it comes to cervical cancer is human papillomavirus. There is a test that can detect it. So you combine that with, you don't need to do it even more than once in 5 years. You do pap smear, you do HPV testing, and they are negative. You can repeat it after 5 years. It's not difficult. Do you know why? Cervical cancer gives almost 7 years warning. It will be warning you because the pap smear is allows you to check the place at least once in 3 years. So if it takes 7 years for the pre-malignant lesion to develop into malignancy or to develop to cancer, you would have picked it, and this is at a stage where you can completely remove it. Are you getting it? You can completely remove it. So I will reiterate and shout this loud and clear. Every lady who is sexually active, 3 years after your sexual debut, you must start to do cervical screening, particularly pap smear. You do it once in 3 years. Let me just leave it like till you are 65 years old, because you are still at risk until you're 65. You can get the complete protocol at your nearby hospital. Check with your doctor or your gynecologist. They'll give you the details. It's not difficult. Are you getting it? So I like to emphasize this rather than how do you detect it. Detection, okay, I've talked about testing. You check, then you take biopsy. These are beyond what our audience can handle. So you take pap smear, you look at it, then if there is a lesion, you do a biopsy, you take it to the lab, to check, and it confirms cancer, then you start treating. Do you understand? That's beyond what our audience can handle. But of course, it's good for knowledge.
Thank you so much for that.
My pleasure always.
So, doctor, does cervical cancer really kill?
Any abandoned disease that is not properly managed can kill, and one of them is cervical cancer. Sadly, it is highly preventable. It should not kill any human being. But unfortunately, it does not only kill, it also makes life miserable for years before it eventually takes that life. For what is highly preventable. So I like to emphasize the area of prevention, basic steps to take to prevent having cervical cancer. It's sad to tell you that in the world, it's still discovered that over 570,000 people, ladies, come down with cervical cancer yearly. Are you getting? That's data from World Health Organization. And out of, you have over like 311,000 dying. So to answer that question, does it kill? 311,000 dying on a yearly basis for what is highly preventable. Let me bust your head by saying that out of this figure I've mentioned, no matter how big, either correct or incorrect, no matter how big they are, over 75% to 80% are in sub-Saharan Africa. You can hardly hear of cervical cancer in Australia, in some places now, because of the strict adherence to the screening protocols for early detection and treatment. So it's not supposed to kill, but it definitely kills. And worse enough, it makes the life miserable before it eventually kills.
Wow.
For what is highly preventable.
Thank you so much, sir. The next question on my list, you have attended to that already.
All right.
So let me just move to the next question. Can cervical cancer affect fertility or sexual health?
All right. Fertility, sexual health. It's highly irritating to have regular sex when you're having foul-smelling vaginal discharge that is resistant different form of treatment. Are you getting it? So number one, their regular sexual exposure is affected. Number two, look at contact bleeding. I talked about contact bleeding. It can become messy when you're having sexual intercourse and there's blood everywhere. So it does not encourage you to further want to. So, and when you are desirous of pregnancy, when you are having issues with fertility, one of the things you want to do regularly untimely sexual intercourse. So that's that. And in the advanced stage, you're struggling to live a quality life. The question of will not even be there. Now, the question is there a treatment if someone is pregnant now? For instance, that's another way it affects. If someone is pregnant and around that time you diagnose cervical cancer, it becomes a very dicey situation. You know why? Because the various forms of treatment available for cervical cancer can affect the baby. And leaving the condition to linger on can encourage spread and lead to advanced state that would be very difficult to treat. So you are in a situation where you need to take a stand. So that's another major concern. So, but we usually eventually look at the viability of the baby, the stage of the cancer, and we decide. Sometimes you forgo the pregnancy, you treat. At times you allow the pregnancy to go to advanced stage, you deliver the baby, then you treat. So there is an established fact about the effect it can have on fertility, even when you eventually get pregnant, has some effect.
Wow. So one can still be pregnant and still have cervical cancer?
Absolutely. And that is why we actually emphasize the need to not wait for symptoms before it. Because a person who has a fully established cervical cancer during pregnancy must have been showing signs even before she got pregnant. Assuming she has followed the screening protocol, she would have picked it. But a person who is not screening conscious, who is not following the protocol, can have cervical cancer anytime. Even either you are pregnant, you are not pregnant. It's the service. The service is there. It's responding to all the insults and it's moving on. So it's only when you keep checking that that during pregnancy, most time we check what is going on. Well, that's what we do. That's why some people even get close to the hospital. And we are even making noise for some people to even go to the hospital when they are pregnant. Just imagine this scenario. So it is very possible. It has a lot of significant effect on fertility, pregnancy, and so on.
Okay, thank you, sir. Does it really affect one's daily life?
So now, being conscious, being aware of the possibility of cervical cancer should be part of your living. And that's when you remember that, if you remember I'm supposed to eat in the morning, or for those of us that eat once a day or twice a day, and you remember that, this is what I'm going to eat. On so day I'm going to do this. On so day I'm going to do this. On so days I'm going to do health check. It should be part of your life. So when I'm sexually active, 3 years after my sexual debut, I'm supposed to screen for cervical cancer. Or I'm supposed to screen for cervical lesion. Perhaps I'm supposed to start my PAPs here. And I'm supposed to be checking this every 3 years. It's a thought process that should be part of your living. When you allow cancer to be established, I haven't missed all the prevention. You remember I said, prevention is always better. When they say this slogan, don't take it for granted. All this mantra, prevention is better than cure, health is wealth. Even if you detect, if the person has cervical cancer, you detect it early, and they treat it, the 5-year survival rate is over 90%, 92, 95 in some areas. But when the patient presents late, it makes life miserable towards the end of life. I don't even want to describe it. I don't want anybody to experience it. It's not a sight to behold when you present with advanced stage of cancer with all the intervention. Don't get me wrong. If you have cervical cancer detected at early stage, it can be treated. You'll be fine. Absolutely. It may have no.
That's if it has not gotten worse.
Yes, it may have no impact in your day-to-day activity. That is why we are making us bad. Do you understand?
Yeah.
So it may affect your day-to-day activity if you allow it to remind you and push you to diagnosis, not that you looking for it and hitting it on the head when it's trying to show its face.
So viewers, now I believe the saying prevention is better than cure.
Note, vaccination does not preclude the necessary screening. The fact that you have been given shots, HPV shots, you have vaccinated yourself, does not preclude the necessary regular screening you do every 3 years, starting from 3rd year after your sexual debut. By that I mean when you start to have sexual intercourse. 3 years after you start, and you do the screening every 3 years till you're 65.
So I'll advise us all to always go for our checkups, do your screening, visit the gynecologist, and make friends with your doctors so you can always get more information from them from all these ugly conditions.
Absolutely. I think it's enough to say that it's one of the most common preventable cancer. I will advise us to drop comments, to ask questions, and then feel free to share any experience you have in the comment section. You can follow us on Instagram, Facebook, TikTok, and above all, YouTube for educative sections. Thank you for watching.